In Utah just this year, there have been 7 cases of abuse by certified nursing assistants, some against the elderly. ABC4's Andrew Reeser tells us how you can protect your loved one in need of assistance and how the state investigates claims of abuse.
The number of CNA abuse cases has grown in the past year, and while it's still a rare occurrence, officials say it's important for families to be empowered. 30-year-old Jason Knox is still behind bars in Davis County, facing 10 counts of abuse or neglect of a vulnerable adult. If he's found guilty, he'll not only end up in prison, but also here on Utah's CNA abuse registry.
They're there for life unless the case is overturned in a court of law or we're notified of their death.
Donnell Ricketts is executive director of Utah Nursing Assistant Registry in Kaysville. Her organization monitors the tens of thousands of CNAs registered to work in Utah. She says this year alone, 7 CNAs have been added to the abuse registry.
Abuse could be a number of things. It could be verbal abuse, physical abuse, psychological abuse. It can be intimidating a patient or a resident.
Reporting abuse involves a chain of command. A family member or worker can report abuse to Adult Protective Services, who investigates, and if the claim is credible, APS reports that to the Utah Department of Health, who then reports to UNAR. The Department of Health typically only investigates federally funded facilities, so families are encouraged to make sure private practices have completed those background checks on CNAs working with their loved ones. The Utah CNA Abuse Registry has been around since 1991. So far, 243 CNAs have been added there permanently. Ricketts says that site is open to the public, so you can make sure your loved one is in good hands.
Check them out.
In Kaysville, Andrew Reeser, ABC4 News.
So here's a look at how those numbers break down. Since 1991, there have been 149 cases of abuse in Utah, 7 neglect cases, 53 misappropriation of property, and 34 unspecified cases involving CNAs here in our state.